Hello and good morning, everyone. Thank you for joining us for our virtual open enrollment seminar. At this time, we will go over Kaiser Permanente medical benefits for plan year 2026. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you type a question in the chat box, everyone attending the session will see your question and your name. So we encourage you to reach out to the Employee Benefits Division or your benefits ambassador if you have sensitive or confidential questions. Lastly, today's seminar is being recorded, and a copy will be posted on the Benefits Open Enrollment website along with a copy of the slide deck. At this time, I will turn it over to our presenter, Rachel Aguilar.
Thank you. Good morning, everyone. Thank you for taking the time to be on today's call. As mentioned, my name is Rachel Aguilar, and I am an engagement specialist with Kaiser Permanente. And the purpose of today's call is to go over your 2026 open enrollment benefits. The great thing is that we're also going to review added benefits available to you at no cost or at a discounted rate, and how convenience and connected care allows you to access seamless care at Kaiser Permanente's medical facilities. And if we're ready, we're going to go ahead and get started. And first, I do want to mention what makes Kaiser Permanente unique. And again, as mentioned, we own and operate our medical facilities. So we're not just your health plan, we're also your medical provider. With that said, I did mention connected care. And if you're a current Kaiser Permanente member, you know that all our medical facilities, you'll find care under one roof. So it's a one-stop shop. Our mission is to provide high quality, affordable healthcare to our members and the communities that we serve. And what we want to do is here at Kaiser Permanente, we want to provide a high quality care where your physical and mental health care, routine checkups, complex treatments, and mental wellness care are available to you. So what that means to you, it allows you to reduce stress. And what we want to do mainly is keep the whole you healthy, mind, body, and spirit. Adding those options available to you under Kaiser Permanente. So again, you're going to hear me mention we combine care and coverage. So basically what that means is your care team is connected. So your care team speaks to each other, right? So all your care is under one roof. But most importantly, I'm out of San Diego, California, but California alone, we have 17,700 physicians available to you. And what that means is that they're all connected. So not everyone has the same medical needs. What that means to you is that once you have a care member accessing or treating you, they have that information available to you in real time. So what that means is your electronic medical record not only connects our care team, but they connect them to you to offer that high quality personalized care to you. We offer seamless in-person and virtual care. So please know that we still have video visits, telephone visits that are available to you with your primary care doctor. But not only that, we now offer 24 hours a day, 7 days a week access to get care now. What that means, you have clinicians at 3 in the morning that could treat you if you have any medical conditions or you're not feeling that well, right? So personal experience. And when I say connected care, they see your information in real time. I called once at 3 in the morning, mentioning I have horrible stomach pain. What he said, the first thing he said, again, it's a clinician. It's not my primary care doctor. It's someone that's treating me over the phone. He said, Rachel, did you have anything that caused this pain in your stomach? Because it was stomach pain. And I said, no, I don't think I did. He said, I see here you have food allergies. And I said, this is different. So please know that that information is there available to our care team to treat each person because again, they have personalized each member is different, so it's personalized care. With that said, that visit was available to me at no cost. What he said, do you want to go to the emergency room, get blood work? I got blood work. Getting that blood work, by 11 a.m., he told me I had a stomach infection. I was picking up my medication. So it's just, again, convenience, how we access, how we treat our members. So please know that that's an option that is available to you. We offer support for mental health and wellness. So please know that we have uh, multiple options available to you for the when it pertains to the services, from dependent. If we're looking at virtual in-person visits, we do have that available. Group sessions, that is available. So please know that we do have multiple options available to our members. So we're all used to getting instant information on our phones, right? So when it comes to health care through Kaiser Permanente, if you have a quick question, you always have the option to quick search Google. You get hundreds of articles, information available to you. At Kaiser Permanente, you could get high quality care as easy as ordering simply an online sign in from to our app. So we encourage everyone. It is at your fingertips. So basically, with our Kaiser Permanente app, what that does, it helps you to stay on top of your health. Right. So by using that, you can manage a family member's care. You could schedule an appointment. You could view your lab works. You could order prescriptions. If you are a person that has, they're taking maintenance medication, you could avoid going to the pharmacy and receiving that medication directly to your home. So please know that these are options that are available to you. So the only thing you need to do is download the app after you register. Once you register, all you need are three things: your medical ID number, email address, and creating a password. It is as easy as that to access that information. So we know, and I did mention seamless in-person virtual care. So at Kaiser Permanente, once again, I'm going to mention how connected care and coverage works together. So again, you have access to 24 hours virtual care, and did mention and gave an example. You could email your doctor with non-urgent questions at any time. So for those new mommies that are sometimes worried when it comes to their children, if they have questions, or sometimes we're at work, right, and we leave our kids sick, we could manage our children's care. Just send a quick email. Just let them know, this has been going on with my child. Should I bring them in? Should I get a blood work? What do you recommend? And it's as easy as that. And if because it's an email, your physician will reply back to you within 2 business days. So please know that that is an option. I did mentioning, once you register on kp.org, you could view your lab works, you could refill prescriptions and schedule appointments. What's important to know about this is you could schedule an appointment with your physician. However, if your physician is not available, it does give you the option to schedule a physician within that medical facility that you're visiting. Okay, so please know that that's an option available to you as well. You could also view your statements. So we will be reviewing a couple of plans that have deductibles. You can manage your deductible, your out-of-pocket maximum as well, once you register on kp.org or download the app. So this is why we encourage our members to register, download the app, so you could get more out of your benefit and stay on top of your health. Okay, so as far as in person, we did talk about if you are a member, and again, we are a Kaiser Permanente option. We own and operate our facilities, but please know that I'm going to review care away from home. You do have that option where if you are traveling, if you're traveling within the nation, and let's say you're going 5 hours away from San Diego, which is Las Vegas, and you come across an urgent situation, you have medical needs, please know that you could go to the nearest minute clinic available to you. And what that means to you is that you're paying a co-payment versus paying out of pocket. So please know that when traveling, there is assistance. We have the away from home travel line that you could call, and they'll refer you to the nearest facility that you could visit. You also, if you're traveling internationally or maybe within the nation and you want to fill prescriptions in advance, you could fill your prescription. Preventative care is key on how we practice medicine at Kaiser Permanente. So please know that if you are traveling internationally, let's say you're going to Asia, you could call that travel away from home advice line. And what they'll let you know is if you need any type of vaccinations before travel. So please know that these are great options available to you just by being a Kaiser Permanente member. Again, you are covered for urgent and emergency situations within Kaiser Permanente. So care that's world class. So we're known for catching potential problems early with our robust preventative screening rates. If you do have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cardiac care. And again, no two hearts are alike. There are many types of heart diseases, and different people need different types of care, from initial diagnosis through treatment and into recovery. So everyone's different. And we mentioned that earlier. So again, your recovery will make the decision that your doctor will offer a care team that will work with you and your family um, once you're ready to so it's not just yourself, we're treating your whole family. So please know that once we do find and help you get to where you need to be in your health, there is a team that's going to work with you and your family. So again, it's offering that personalized care to each member. World-class maternity care. So again, my children, I have a 19-year-old, 18-year-old, both born at Kaiser Permanente. The experience was incredible when I was that new mommy. So again, if you're here to trying to expand your family, a dedicated prenatal care team will be available for you. A personalized birth plan, care and support every step of the way. And again, remember, support doesn't stop at delivery. So we have multiple programs available to support our new mommies or mommies after they have their baby in their home. So please know that Kaiser Permanente works with you. Again, it's a team that we have to work with our members. And support for mind and body. Okay, support for mind and body. What is it that we have available for you? So you have access to licensed therapists. And before I move on, licensed therapists are available. We do have family counseling that's available. If anyone's struggling with substance abuse, that's covered under your plan. We have virtual, in person, whatever option is available to you or works best for you, that's the option that we have available. We have group sessions that are available. So please know that there's a lot of options when it comes to mental and emotional health. We also have our self-care apps that are available to you at no cost. We have the Calm app. Calm prompts you to meditate throughout the day. It provides background music if you're having trouble sleeping. It has bedtime stories as well. And this is an app that's available to you at no cost. The cost without being a Kaiser Permanente member, last I checked, was $70. All you need to do is visit kp.org/self-care apps, create user ID and password, then download the app and just log in. We also have a new app that's available to our members, which is called Headspace. It's replacing Ginger. So Headspace is texting for emotional support. So once that is available in multiple languages, English and Spanish. So it could be from just something as uh, being anxious, and I'll use myself as an example, to teenagers. Sometimes I'm not sure if I'm being not strict enough, and sometimes it gives myself a hard time because I'm too strict. So I text someone 24 hours a day, 7 days a week. They provide an action plan and they tell me they're teenagers. You're doing good, relax. So it just gives me comfort, right? It helps me have a better day because it didn't start like that. So that's an option that is available. If you have children dependents over the age of 18, maybe they're in college, please know that this is an option available to them as well. Maybe they're feeling blue, that maybe they're feeling overwhelmed, but it's their first year in college. As parents, we know this is a great option that they could use, and there's a clinician that's going to work with them and provide an action plan. Okay, so please know kp.org/self-care apps. You'll find both apps on that landing page. Select both. You're able to register to both. Again, create user ID, password, then download the app and log in. And we also now are offering gym discounts. So we want to, again, we mentioned we want to keep your mind, body, and spirit healthy. We now contract with OnePass. So OnePass is a platform that we use. It's through the Optum network. So what they're doing, they're giving our members discounts for accessing the gyms that they work with. So how that works, it's basically tiered based options. It's a one-time enrollment fee of $29 if we're doing those in-person visits to gyms, and a monthly charge of $34 if we're under that classic tier, $69 if we're under that standard tier, 109 if we're under that premium tier, and the elite, it's $249. What makes this attractive is again, you're not locked into a contract. It's again a one-time enrollment fee of $29. You could always buy up or buy down. If you're under that standard tier, you could participate on all the tiers that are below that tier. If you're again under that elite tier, you could always participate on the tiers that are below those that tier. So you have the flexibility to go up and down. One-time enrollment fee of $29. That digital option is $10 a month and a $10 enrollment fee. So please know that this is an option. And the gyms that do participate under that tier, I'm sorry, I thought I had the gyms on the next slide. So how it works, let's say in my zip code, it's by zip codes, you're a OnePass member, right? So in my zip code, I have LA Fitness, Choose, YMCA, and there's more gyms that participate with OnePass. I could switch gyms every day. So what's going to happen? OnePass is going to give me a barcode, and I'm not going to be a gym member. I'm a OnePass member. So with that barcode, I'm going to be accessing all the gyms that participate under my tier. Okay. So you have that as an option. And if anyone has more questions on OnePass, I'll be happy to answer after the call because I know this was a popular option. Okay. And now let's go ahead and go over your benefits. And what I like when I see we have multiple options and benefits, and I did start off by saying that not everyone has the same medical needs. So with that said, we have three options to present. We're going to start off, we're going to do a high level overview of the two first options, and we're going to go, on that third option, we'll go line by line. So basically what we put together for you is under your traditional HMO plan. As everyone knows, that traditional HMO plan is when you're seeking for care, you know up front that you have a copayment for those services, right? So under this option that we have, which is great, there is no deductible. So what that means is once you're visiting a facility and you're there for a service, there's a copayment associated to that. So as we can see, the office visit, it's $25. Video visits, as we mentioned, is covered at no charge. But you do have your out-of-pocket maximum. And with that out-of-pocket maximum, what that means to you, this is the most you'll pay in services during your accumulation period. Okay, so that's $1,500 for one individual and $3,300 for a family of two or more. Okay, this tells you worst case scenario scenario, this is what you're going to pay during your accumulation period. As far as your outpatient services, you have a $25 copayment per procedure. Hospitalization, you have a $100 copayment per admission. Emergency care, it's a $125 copayment per visit. And again, we have your prescriptions, right? There is a 30-day supply. You have a $10 copayment for generic, a $25 copayment for brand, and a $25 copayment for specialty medication. So please know that your prescription medication, if it's mail order, you do have a 100-day supply. So you're getting more if you're taking advantage of the mail order supply if you are under maintenance medication. So you pay $20 copayment for a generic, and which gives you a 100-day supply, and a $50 copayment for brand name, which gives you a $50 I'm sorry, a 100-day supply. So please know that it has a great convenience by filling a mail order prescription. So we do have your high deductible option. On your high deductible option, there is a yearly deductible that you need to meet at the time of service, and that's $1,700 for one individual, $3,000 for a family of 2 or more. And please know that, and I'll use myself as an example. I do have a child that's an athlete, so at times I could be under that family tier. But if my son, for some reason, he's a kickboxer, so if we come across a situation where he needs services more than mom and dad and sister, his out-of-pocket max is $3,400. So that's for the individual in that family. Again, maximum out-of-pocket, you have $3,400 for one individual, $3,400 for one individual in a family, and I use my son as an example, and $6,800 for a family of 2 or more. Okay, so please know that you have that option when you're on this high deductible health plan as well. Preventative care is covered at no charge. You have a doctor's office visit where you have a 10% co-insurance after you meet your deductible. So that deductible does need to be met. Your telehealth is covered at no charge. Lab radiology, outpatient surgery, hospitalization, emergency care. There's a 10% co-insurance after you meet your deductible. Okay. Prescription medication, you have a 30-day supply, and there's a $10 copayment for generic, a $30 copayment for brand name, and a $30 copayment for specialty medication after plan deductible. Prescription medication for mail order, it's a $20 copayment for that 100-day supply, $60 copayment for that 100-day supply, and you do need to meet your plan deductible. Okay, so these are your current options. So let's move on to your new option, which is a deductible HMO everyday care plan. So remember, I mentioned I have a son that's an athlete. So for me, what works is that set copayment, because 2 weeks ago we got called into Zion Hospital because he almost had a surgery. He did fracture his leg. So and tomorrow he has a visit to get another X-ray. So we're high utilizers for medical care due to my son. But the great thing is that you have options. You could shop based on your needs. And this everyday care plan is for those people that do not use services as much. They're not high utilizers, right? So we do have a yearly deductible built into this plan, which is $2,000 for one individual. Again, I'm going to mention there is a $2,000 yearly deductible for that individual in the family that maybe use services more than others. And then you have a total of $4,000 in deductible for the whole family, right? That they need to meet. So your maximum out of pocket is $2,000 for one individual, $2,000 for that high utilizer in your family, maybe that they had a bad year, it's $2,000, and $4,000 for the whole family. Okay, again, Kaiser Permanente preventative care is key on how we practice medicine. So you will always be encouraged, regardless what plan you're on, to get your annual physical. My recommendation, always ask for your physical based on your age. The reason for that, you get more in that visit done than just a regular physical, okay? Doctor's office visit, you have a $10 copayment. However, under this option, you do not need to meet your deductible. So plan deductible does not apply. So you actually are visiting the physician and paying your $10 copayment, and your deductible does not apply. Uh, telehealth, telephone visits, video visits, that email to your doctor is available to you at no charge. Lab test, x-rays, you have a $10 copayment per encounter, 50 per encounter, and plan deductible does not apply. Okay, so now let's see where the deductible applies. It usually applies in major services. In this situation, you could see MRI and more CT scans at PET scans. You have a $500 copayment per procedure, and your plan deductible will apply. Okay, outpatient surgery, no charge
Sorry.
after. Yes.
The MRIs, CAT scans, plan deductible does not apply, just the $500 per procedure.
Thank you. Thank you for that clarification. So it's just the $500 per procedure. Plan deductible does not apply. Sorry about that. So your outpatient surgery, no charge after plan deductible. Hospitalization, no charge after plan deductible. Emergency copayment, it's a $500 copayment. You know what? There we go. I just made my screen bigger. Sorry about that. $500 copay per visit, plan deductible does not apply. Okay. So as you can see, it's the deductible will only apply for certain services. Prescription medication, you have a $30 copayment, a $10, a 30-day supply, a $10 copayment for generic medication, a $50 copayment for brand name medication, and a $250 copay for specialty medication. Plan deductible does not apply. Okay. Prescription medication, you have a $20 copay for generic medication, a $100 copay for brand name medication, and your plan deductible does not apply. So these are the three options that are available to you. So please know, I always recommend shop based on your needs. This is a great option that is available. And just by knowing that your deductible won't apply for that office visit, filling your prescription. So please take advantage of this great option that's available to you. So we know that when it comes to choosing your health plan, it's a big decision, right? So at times it could be hard making that choice alone. Please know that we have a department that's going to work with you and walk you through the information that you need to know to make the right decision. So the numbers on the screen, we have a QR code as well listed there. This is available to you Monday through Friday. From 7 a.m. to 6 p.m. Pacific Standard Time. If you are new to Kaiser Permanente, we have a wonderful onboarding program. What that means to you is that we're going to make sure that you have all your information so you can access care. And we're going to work with you. Your care team's going to reach out to you. And something that I like to inform our members is we are an HMO plan. However, you do have the choice to select your physician based on your needs. So based on location, based on gender, based on the needs that you're looking for, that it could be physician closer to work versus closer to home. So please know that you do have that option, okay? And a personal experience, a 15-year-old daughter had a male physician, wanted a female physician. It took 2 days for that change. So please know that it's as quick as that. So now let's go ahead and go over some service area updates that we want to share with you. So just to mention, across California, we have 441 medical facilities available to you. Again, we contract with 17,700 physicians that are available to treat our members here at Kaiser Permanente. We're top-rated health plan in California for 9 years in a row. Of the 24 commercial health plans in California, we're rated by the National Committee for Quality Assurance. Our plans are the top rated in the state for the 9th year in a row. We're top rated quality medical care for 17 years in a row, for a record setting of 17 years in a row. So Kaiser Permanente North and Southern California received the highest scores for clinicians quality on the California Office of Patient Advocates Healthcare Quality Report Card. So in 2024, 2025, addition of the HMO Quality Report Card, we also earned the perfect 5-star for asthma and lung disease care, behavioral health, mental health care, so treating children, diabetes care, preventative care screening, heart care in Northern California. And we're leading in 105 effectiveness of care measures. In 2024, Kaiser Permanente led the state as a top performer in the HEATS Healthcare Effective Data Information Set Effectiveness of Care Measures, the most of any health plan ever received. So please know that we're top rated in California. And we also have updated facilities available to you, scheduled to open in 2026. So also Creek Medical Offices. We have departments, dermatology, family medicine, internal medicine, laboratory, nurse clinics, OBGYN, pediatrics, primary care, physical therapy, radiology, uh, school camp forms. So please know that, again, we're going to have a medical facility with everything under one roof that's going to be opening in 2026. Convenient locations in Southern California that are available to you. And we have a map here. So again, I did mention we have our away from home advice line. So please know that if ever traveling within a state, that there is Kaiser Permanente facilities, you could always access care with a visitor ID card. So please know that that will be an option. And what we want to highlight is the minute clinics and how this works. Minute clinics are available to you here in San Diego. We have in Chula Vista, Mission Valley, and what that means to you is that you could schedule an urgent care visit at a minute clinic versus going to the waiting room and waiting to be treated. So please know that this is a great option for you to have. If you have a sinus infection, ear infection, they're able to treat you and provide a prescription. That's an option that's available to you as well. So please know that the mini clinics inside Target stores are available to treat our members. We also want to let you know that all urgent care facilities, Kaiser Permanente facilities, are available for you to get treated. If you have the app, the great thing with the app is that you could view the waiting times at the urgent cares near you, and it gives you that option. So it's convenient for that reason as well. So take advantage of those options that are available to you. With the Target store, you do need an appointment, and it's an urgent care appointment. Updates in Northern California, what's coming soon. We have the Modesto Sports Medicine Center that's going to be opening in August of 2025. Fresno Orchard Plaza medical offices that will be scheduled to open in October 2025. Modesto medical offices that will be scheduled to open in January of 2026. And now open, we have the facilities that are available. Santa Rosa Infusion Center opened in March 2025. Salinas Medical Offices, Santa Rosa Ambulatory Treatment Center, Santa Rosa Urgent Care, San Francisco Urgent Care is also open. And again, just more convenient options available, locations available to you in Northern California. And this is a snapshot of our away from home care. So if ever traveling, I did mention the away from home travel line. So it's kp.org/travel. They're available 24 hours a day, 7 days a week. Within Kaiser Permanente, again, we have those mini clinics available to you. If you're in another state that has Kaiser Permanente, you're able to access those facilities as well. For out of network, we now contract with the Cigna PPO network. For urgent care needs, we also contract with Concentra Urgent Care. So please know that that's an option in the little clinic, including the pharmacies. So we have more options that are available to you. So please take advantage of those options. And just a high-level overview of a national snapshot of the states that Kaiser Permanente is available to you. So please know that these are the states that are available to you. If you are ever visiting the state, you could use a visitor ID pass and they will treat you as if you were in San Diego. So connected care communities that are available to you, again, just a snapshot of that information for you. And just good health everywhere. So available, this is something that's available to you. You could view more about Kaiser Permanente and our outcomes. So it just gives you a great snapshot of our outcomes. And this is my last slide. So let me go ahead and go back. And see if anyone has any questions. Just go back to I think everyday option is where we have going to have more questions today. So let me just leave it on that slide. There we go. And I'd like to thank everyone today for your attention, and we're opening it up for questions. We could go on the chat. So I know Marcia has been answering.
Rachel, we've been answering questions in the chat box
Wonderful.
throughout the presentation, but I do want to let the audience know, if you haven't had an opportunity to type that question there, feel free to do so. We're available to answer questions. If you don't remember your question now and it pops up later, do know that the Benefits Division is available to answer questions. I'll put our email address in the chat. Also, benefits ambassadors are available to you, especially during this open enrollment period, which will run from October 6th through October 30th. So do know this is not your last opportunity to ask questions. Rachel, can you please show the minute clinic info? It's like a tongue twister for me.
Minute Clinic, here we go. So we have the Minute Clinic slide here, and please know that you're able to visit the facilities that are listed that work and participate with us. So basically, if you have not gone to a Minute Clinic inside a Target store, it's pretty impressive because as you walk in, you'll find that the facility has a Kaiser logo as you're walking in. So definitely know that each facility is known because we have physicians at those Minute Clinics. The only thing I believe that they cannot do there is x-rays. So if you do schedule that urgent care appointment with them, they will reach out to you just to confirm that's not something that you're requesting, because that's something that will not be able to get done there. But for anything else, you're able to get treated there as well, and you could fill your prescription at the Target store as well.
Thank you, Rachel. We do have another question regarding accessing care, urgent and emergency services if you're in another country. And as you answer that question, I'm placing in the chat a link about traveling abroad or out of state to access care. You can go into details about that. That would be great.
Okay. So how that works, if you're traveling internationally, we encourage you to use to call them before, during, and after, right? So if you're traveling internationally, if you're, again, as mentioned, if you need any type of vaccinations, they'll let you know. So that's before travel. If you need to fill a prescription because you need your prescription before you leave, they will work with you and allow you to fill your prescription in advance. During travel, my son, again, I'll use him, kickboxer, World Games, Team USA, semifinals, broke his toe. What I did, I called them. I said, I'm in Italy. What do I do? What's my next step? He broke his toe. What do I do? And what they said is take him to the nearest urgent or emergency room, have them get treated. Once you're back in the USA, submit the claim to us, and then we'll reimburse you minus either your deductible, if it applies. If I have a co-insurance, anything that will apply, they'll reimburse me for that. So please know that that is an option, and that's why I always strongly recommend, if you're a Kaiser Permanente member, please know that you have that away from home travel line that's available 24 hours a day, 7 days a week. They have that specific, if you want to call, 800 number that connects you from anywhere in the world. So please know that that's an option. I'm not sure if I answered your question. Just want to double check with you.
We will find out. We had another question regarding a list of the gyms. So I did place in the chat information on that, specifically for Alejandra, who requested it. But for anyone else, there's a link in the chat so you can access the information for Kaiser's gym and One Pass Select.
And one recommendation on the One Pass Select, when we're shopping for gyms, remember it's tiered based. So what I strongly suggest, type in the gym that you're looking for, because you'll find that sometimes that the gym that you're looking for could be under that classic tier, where it's more affordable than the elite tier or the signature tier. So please note, type in the gym first, and then it will tell you if it's under multiple tiers or if it's under the more affordable tier. So you don't have to sign up to the highest tier to get that gym. So first, and it allows you to do that option. So please know that once you register through kp.org/exercise, you'll come to that landing page. That landing page has want to learn more on One Pass. Select yes, then create your it's gonna you're gonna log in again, and it's gonna take you to the One Pass page, because remember I said you're a One Pass member, but you're getting the discounted rates because you're a Kaiser member. Okay, so please know that there's multiple steps to do, but I always encourage everyone to type in the gym they're looking for, so it tells you if it's under multiple tiers. You select the one that's right for you, because you'll see if that's the option that you want. Okay.
Sharing with the audience, we had a question still coming through regarding the fitness offerings on the gym. Clarification, Class Pass is definitely going away at the end of this year, December 31st, 2025. However, the One Pass will still remain for you guys' use, for members' use.
Right.
So,
right.
Great call out in the chat. Thank you.
Yeah, thank you. So we do have that digital option under One Pass, which is a $10 enrollment fee and a $10 a month monthly cost. So please know that you do still, if you're interested on digital options, because I know ClassPass was strong with the digital option as well, that you're still having it under the One Pass select option.
Let's see, if any more questions. Away from home care applies to all Kaiser members, regardless of what type of Kaiser coverage they choose. Is this correct?
That is correct. Away from home care applies to all Kaiser members. And if you are traveling, if you do reach out to them, and if you do advise them, I'm leaving by this date, they'll let you know, call me back within 2 weeks prior to your departure, and you'll receive your away from home pass cards with that 800 number, just if in case you need it. So just reach out to them and let them know that you're traveling. They'll have that information available for you, so you could take with you. And also on your digital app, you'll have that information. If you're registered on kp.org, you could open and that information is always on there too. So again, convenience of having the app and having that information at your fingertips.
Rachel, along those lines, not just being away for vacation, you may have touched on this a little bit, but for individuals who have children that are away for school, what would be the process for that, and how does that work if they're
Okay.
away for school?
Okay, that's a great question. So our children are our priority, right? And more, and if they're doing, if they're going to school, if it's everything's so new to them. So it's important for you as a parent to know that if they're in school in one of our Kaiser Permanente states, they'll get a visitor ID card and they could receive care as if they're in San Diego. Okay. If unfortunately, if they're outside of a Kaiser Permanente state, they're covered for emergency and urgent care services, but that is an option available to them. And then I did mention, I do have a slide with the states that are available. If you need me to, I could go ahead and I have that, so you can view that. Go ahead, I'm sorry. So I know it's Hawaii, Georgia, Colorado. I'm sorry about that.
Right there, right there.
Yep, you just passed it.
One behind. There you go.
Yeah, there we go. So these are the state, Washington, DC. These are the states that we do offer Kaiser Permanente options. So these are the states that work with Kaiser. So if your children are going to school in one of these states, again, they get a visitor ID card and they get medical care as if they were in San Diego. So please know that they have that as an option. Okay.
At a Kaiser Permanente facility.
At Kaiser Permanente facilities. Thank you.
Yeah. They wanted to ask if you can go back up to the one pass where you have the prices, please.
Yes. Sorry about that. I could manually move it on my end.
It's okay. And I'd like to remind everyone who's in attendance, we will be placing a copy of the slide deck on the Benefits Open Enrollment website as well. That way you can use it for a later reference, along with a copy of this recording.
So these are the prices that are available under the one pass option. Again, we have that classic, that standard, that premium, that elite tier. And that's why I mentioned when shopping for a gym, type in the gym first to see if it doesn't pop up under that classic tier versus the standard tier. You are saving a lot. You're saving money if you realize it's under that classic tier. However, it depends on your options because there's different options under each tier. So again, it's multiple gyms that you could participate with. And just by being a one pass member, one pass gives our members or their members a discounts for grocery delivery from Walmart. So if you want the delivery shipped to your home for free, and if you're a one pass member, you have that option. They also work with Ship It, that works with Target, but you need to have a minimum purchase of $30. And they also provide that service for you. After $30, they'll ship it to you at no cost. So it's just more options under the one pass umbrella that you have as well. If you have my sister, she's not a Kaiser member, but I want her to participate with me. They're not getting this rate, but if they enroll under your portal or your platform, once you enroll, they get a discount for the regular price on one pass too. So you can invite friends or family members to enroll. So they have a lot of options to offer when it comes to one pass. They also have tools or apps to work with you to see where you're at if you're reaching goals. So that's an option to have as well. So it's all available under the One Pass umbrella.
Like our chat box is pretty quiet, Rachel.
Alrighty. And again, to access this option is kp.org/exercise. Learn more about One Pass, and then you get that information there.
A question come through.
Can
In
you
a
bring up?
traditional, oh, sorry, go ahead.
Sorry, I was just going to ask Rachel. Can you bring up the traditional plan, please?
Yes. There it is.
Okay. In a traditional plan, if someone has cancer and needs radiology, chemotherapy, how do payments work in this case? So, radiology would be under, again, radiology, so it's covered at 100% there. So MRIs, CAT scans, PET scans, not sure what other radiology you will need for cancer, but again, if falls under radiology, it would be covered at 100%. Office visits, you would pay your $25 copayments for those visits. If you need to be hospitalized, it would be $100 per admission. So basically, you just follow your copayments while you're getting treatment for cancer. So it's the same copayments you see here. It just depends on what that service falls under. And then can we review what happens when you use the everyday care plan for hospitalization, for example? So again, the everyday care plan, you have co-payments for your everyday type of care. So office visits, x-rays, labs. You will have maybe a telephone visit. You need to see a specialist. All of that would be a co-payment, and you're not subject to the deductible. So you're using your care plan as any other, almost like a traditional plan. However, if you are in need of a procedure, outpatient procedure, or you need to be hospitalized, in this case, maybe having a baby, you are subject to the deductible. So your deductible is $2,000. So the first $2,000 of that hospital stay, you would be responsible for. That $2,000 is also your out-of-pocket maximum. So if you haven't utilized your plan and now you having a baby, you pay the first $2,000, you've reached your out-of-pocket maximum. So for the remainder of the calendar year, you will not pay anything further. So no more co-payments for office visits, no more co-payments for x-rays or labs, no more co-payments should you have an emergency, and no more co-payments for prescriptions. So everything is covered under your plan for you as the individual who reached the $2,000. So if you have a family member with you on that plan, they are still subject to the other $2,000 until you reach the family deductible of $4,000. And so once you reach $4,000 as a family, whether it's a family of 2, 3, 4, or 10, once you reach $4,000, the whole family is covered at 100% for the remainder of that calendar year. Once 1/1 comes around, everybody starts all over again. If you continue with the same plan for the following year, you're again going to restart your deductible, going to restart your out-of-pocket maximum. You're going to pay your co-payments when you access care for your everyday type of care. If you are in no need of hospitalization or outpatient procedures for that year, you never have to worry about paying that deductible. I hope that answered your question. Let me see if I got another one. Did you say you are able to visit multiple One Pass locations with the Classic Pass?
And for that classic tier option, yes. So under that classic tier option, you'll find multiple gyms. In my zip code, my area, I have LA Fitness, Choose, YMCA. So I could I go to different gyms every day. There's more, but those are the ones I know off the top of my head. So yes, that's something that provides convenience when wanting to use different gyms.
Let me see. Did we get? I'm just moving back up because I think I missed a few questions. Traditional plan. I think I answered that one. Okay. Where do you find information as to which type of one pass gym accepts which one pass accepts the gyms? I guess. On the one pass website, I see a location and contact information, but which one pass category do they accept? So I think on the website itself, it says if it's a premium, a classic, on the one pass itself, it will tell you there what category it falls under.
I'm going to pull up a slide right now. So I'm going to stop sharing this deck and I'll pull up a slide so they can see that information. Give me
Thank
one
you.
second.
Is the one pass select by Optum? Does the payment come from the Optum HSA card or is it billed differently? It's billed differently. It's not part of the HSA plan. It's just another, Optum is the provider we use for one pass, but it's completely separate from the HSA plan. So you would be billed directly for that one pass. It would be paid outside of your HSA plan. Would a traditional HMO or an everyday care plan be more beneficial than when expecting a baby? Well, it's up to you. I mean, when you're expecting a baby, if you're on the traditional plan, your hospitalization, I believe, is covered at 100%. So you wouldn't be subject to a deductible. But please note that, you have to really take a look at what your medical expenses are for you and your family, because the traditional plan is going to cover you more, but you're going to pay more out of your paycheck for that particular plan. Your everyday care plan is going to be in the middle between your traditional plan and your HSA plan. So, if you're not going to access care for a hospital or outpatient procedures, maybe the everyday care plan would be a more beneficial plan for you because you do go see your doctor. Maybe you have a chronic condition. You get your labs done every 3 months for that chronic condition. Whatever that may be, you may have a less out of your paycheck, and you're only worrying about paying that copayment when you access care, versus another person who maybe never access care, would like to save for retirement, would like to have that HSA so that they can, provide for their health when they retire. They can continue to build up that HSA from year to year, and they don't have to worry really about accessing care except maybe for their preventative services. So you really just look at your own family and your own finances and determine which plan is going to make more sense for you. You take a look at how much you're going to pay out of your paycheck for that plan and how much you're going to access the plan throughout the year, and then determine what would be best for you. Rachel, were you going to share that link of I keep seeing that question come up of the gyms? And you're on mute if you're talking.
So this is a deck that I have for OnePass. Again, I know everybody's on the OnePass page right now, but we encourage you to go to kp.org/exercise and just going through. So these are the flexible membership options, and these are gyms that participate, right? So under that classic tier, you're going to find LA Fitness, Planet Fitness, Crunch Fitness, Anytime Fitness, Snap Fitness, EOS Fitness. Again, it changes based on your zip code, but you could switch gyms. You could switch gyms every day. So you're going to get what you're going to get is a barcode on your phone, and you're just scanning as you walk into the gym because you're a OnePass member, right? So we have the standard, the premium, the elite option. And I mentioned the Walmart, the discounts, the food delivery. And these are the they also have an app where you have the digital fitness solution, how to manage your membership with OnePass. So you have that option as well, but digital tools to boost membership engagement as well. And I'm going for that page, that landing page. The landing page, here it is. So basically, this is where you're going to type in your gym that you want to use, and it's going to tell you what tier it's under. Okay, so once you select that tier, it will prompt you to all the gyms that will pertain under that tier as well. So it's not you're only looking. Maybe I started looking for LA Fitness, but when it popped up under my zip code, I found that there's other gyms that I want to go to. So it's going to give you a list of gyms that participate under each tier in your area. Okay, so hopefully that made sense and answered your question. And just going back, just more options under that OnePass umbrella. Again, kp.org/exercise, log in, and then it's going to take you to this landing page. And this is where you're going to type in the gym and zip code that you're looking for. And again, just want to be sure we know that you're able to visit multiple gyms, switch gyms every other day. Okay. Any other questions? It gives you trackers. You have the option to download their app as well. You have the option to if you're under that classic option, you have the option for the digital option. It's included because you're buying up to that classic option. So please know that you have the option for digital as well. If depending on the tier that you're on, if you're on the higher tier, you could switch to any gym under the tiers that you're selected. So if you're under that standard, you go to the participating gyms under the standard, under classic, and the digital tool option. So please know that you have that as an option as well. This is the option that we're looking at.
Thank you, Rachel. While you're looking for that, I'm just sharing with the audience that we're trying to cover all questions here in the chat. So bear with us. We don't want to miss anybody's questions.
Of course.
Marcia, thank you for assisting with the chat box. How are we looking on your side there?
It looks like I think we got most of the questions. I hope I didn't miss any. Where will you be posting the presentation? We have shared the presentation, and County of San Diego will be posting it for you so you can look at the different plans. Where can they find it, Nidra?
I will paste a link to the benefits website where we'll include a copy of the presentation along with the slide deck.
Thank you. So that's where you can
Absolutely.
go and compare your plans if you like. I think that's all the questions we have gotten.
Okay, so for the group, I just included in the chat a link to access the recorded sessions and the slide deck. And then for the Kaiser Permanente county page, it's specifically for county employees, I'm including that in the chat as well. And that way you can get a head start on reviewing the differences between the plans and be prepared to ask us more questions after today's seminar. Well, I do want to take this time to thank Rachel and Marcia again for putting together such a wonderful slide deck for us and a lot of information here. Just a reminder for everyone, open enrollment is coming up, and your benefits ambassadors along with the benefits division are available to answer any questions that you may have. So I'd like to thank everyone as well for joining us today. And this concludes our seminar.
Thank you for having us. I just added in the chat a QR code for new members and a QR code for the mobile app if they want to download that.
Excellent. Thank you.
Thank you.
Thank you all.